In this video, we're going to look at what the prosecution in the Lucy Letby case said regarding child E. I wanted to begin by reminding people that this is a continuation of the video that's on the screen now, Lucy Letby Prosecution Closing Statement Full Analysis, in which we looked at approximately the first 3.5% of this closing statement. I also want to remind people that this closing statement goes on for quite a long time. It's over 100,000 words, and as you can see, it goes on and on and on and on. So this will be the section related to child E is approximately 4.5% of the speech. So if we get to the end of child E in this video, that will mean we've done 8%. I can't guarantee that because it's still an enormous amount of text. It's 4,500 words. But we'll get into it in this video and we'll see how far we get into analysing this aspect of the closing statement. So I have arranged what the prosecution said about child E on the screen here, and we're going to go through this and analyse it. I should emphasise that this is what the prosecution barrister Nick Johnson said in his closing statement regarding child E. It's fairly difficult to split this up because he did associate this with child F and did even discuss other infants during this section, but broadly speaking this is related to child E. We may not get through all of this text in this video, but I'll work through it as quickly as I can. So he begins by saying, so 5 weeks after she had put that forward as an explanation, she had to admit, didn't she, that she was still in contact with the people she had originally told you she had not been allowed to contact, and she had not contacted. Even though she knew what we had from her phone, she did actually repeat the lie before it actually dealt with the detail briefly. But then we went to the spreadsheet and the lie was exposed, wasn't it? Do you remember it being suggested to Dr. J-Ram? And I'm paraphrasing what was put to him. So there's two things to say about this paragraph. Firstly, it repeats what we saw in the first section of the closing statement of taking extremely trivial details and then trying to use those to brand Lucy Letby as a liar. The second thing is that we actually know from the Thirlwell inquiry that this was completely true. We know for a fact that Lucy was prevented from contacting people, she was isolated, and she was stopped from participating in normal activities related to the unit, even when she was not suspended, just in this administrative clerical role. So actually, ironically, what she said here was completely true. Now, Nick Johnson didn't actually know that, so this isn't an outright lie, it's just an incorrect statement. Moving on to the second paragraph. You think that just because you're a doctor, people would just accept what you say. Why? Why should you just accept what someone says because they're a doctor? I mean, again, we've seen this throughout the trial. It's a massive problem in society generally, just the pedestalization of doctors. Like, doctors make mistakes, doctors are human beings, doctors are just people who've done a university course. That's all they are. They have some expertise, they have some knowledge. Their role arguably should be respected, I suppose. But you just don't automatically accept what they say because they've done a medical degree. Absolutely not. I mean, this is just nonsense. But of course, the reason for doing this is to try to pit the trustworthy doctors. We must automatically trust them because they're doctors against, the lying nurse. So it's quite strategic. We saw that in the witness box from Lucy Letby. She thought that if she said something often enough, whatever the evidence is, you will accept it. You remember that I actually discussed this technique in a previous video. The one where it's got my dog walking in the snow. I actually mentioned that this is a genuine technique. I don't think Lucy Letby is enough of a propagandist to be able to do that. I think she genuinely believed what she was saying, and we know for a fact most of what she said was accurate. You might want to bear that in mind, ladies and gentlemen, when you're considering anything else that she has said at any point in this case. We suggest that Lucy Letby is an opportunist. So as we continue, you see the complete dearth here so far of any solid evidence or any evidential statements at all. It's just trying to cast Lucy Letby as the villain, the liar, or as he says here, the opportunist. It's just casting aspersions on a character essentially. Some of the children she targeted were sick, but they would have recovered. How can you make that statement? You cannot categorically make that statement with any confidence. No one can, but you definitely can't because you have no medical qualifications. but she used their vulnerabilities to camouflage her attacks. So this is a fairly remarkable claim. The idea that Lucy Letby decided, right, these infants are vulnerable, so I'll use their vulnerabilities to make my attacks less obvious. One could not unreasonably state that every infant on a neonatal unit is vulnerable, that's why they're on a neonatal unit. They won't survive if they're not on a neonatal unit. They're fundamentally vulnerable by their very nature. So she could have attacked all the infants on that basis. If you're saying that vulnerabilities is significant, it's not significant because there were lots of vulnerable infants that weren't included in the indictment because Lucy Letby wasn't on duty for those infants, as we know, and that we also know those infants outnumber the infants that were in the court case significantly. Anyway, moving on. Fortunately, in this desperately sad and tragic case, her perception, or rather misperception, of some of these children's vulnerabilities became a feature which was going to give her away. So this is classic. What's coming up next? She thought that the babies A and B, twins, had inherited a blood disorder from their mum, so she thought she could get away with killing baby A and trying to kill baby B in June 2015. Now, I think that's what they describe in court as, or in the legal profession generally, as supposition. To make that as some sort of solid assertion is completely ridiculous. That would apply if it was factually correct. Of course, it's not factually correct. Many doctors, many medics, many scientists also believe that there was an inheritance of a blood disorder, which is antiphospholipid syndrome. So the idea that Lucy Letby thought, oh, they've got a blood disorder, but I'm wrong about that, but I can use this to get away with killing these infants, and no one will think of anything because they'll just think it's absolute crap. I mean, it's pure speculation. There's just no basis for this whatsoever. It's an assertion that isn't. There's not even any attempt to back this up evidentially. So when I started to look at this closing statement, and when I started to look at the prosecution, I was reassured by people that believe Lucy Letby guilty. Oh, the quality of evidence is incredible. As soon as you start to look at this prosecution statement, you'll change your mind. And then you actually go through it, and there's so much. I mean, to call it supposition is actually generous. It's pure speculation, frankly. So Nick Johnson continues, and if she had stopped there, she probably would have got away with it, wouldn't she? But she googled haemophilia and used the information to inform her attack on baby N a year later in June 2016. So we need to pause at that point and examine this sinister incident that Nick Johnson is mentioning here. So this is a record of what occurred in court on the 12th of October 2022, where there's a child that has haemophilia. So at 2:50 p.m. On the night the 2nd of June, Lucy was on shift and not the designated nurse. So this is littered throughout the court case of Lucy not being the designated nurse, and because she's considered to be more experienced and more qualified, having worked on a level 3 unit, and clearly a competent nurse, very highly regarded by her colleagues, as we've seen universally throughout the department, she's often doing things to help and assist when the unit is under pressure. As we know, the unit was under massive pressure. So essentially what she does here is she's texted some friends and sent a message to a colleague stating that there's a baby with haemophilia, which is correct. She sent a further text saying everyone a bit panicked by seams of things, although baby appears fine. 8:04 p.m. she sent a text saying that she's going to Google haemophilia. 7 minutes later, Letby texted a colleague, complex condition, yeah, 50-50 chance antenatally. So all you're seeing there is just a perfectly normal thing for a nurse to do. That there's nothing about this that is unusual. It's the only thing she could have reasonably done under the circumstances. She just realised there was a medical issue, and she researched it because she's not a medic, and then she found out the circumstances, and then she communicated them to her colleagues. In the closing statement, Nick Johnson is trying to make this sound like some sort of sinister incident, when in actual fact she's doing what she should do as the responsible nurse that she was. As she's not the designated, an irresponsible thing to do would be to say, I'm not the designated nurse for that infant, I'm not going to be involved. And just, busied herself with her own business and busied herself with her own infant and not got involved. that would have been an irresponsible and poor piece of nursing, but instead what she did was she tried to help out. Apparently that's a bad thing to do, but considering that elsewhere in the trial, Nick Johnson suggested that she was wrong to call a doctor when her baby collapsed and deteriorated, Lord only knows what other claims will be made. So when speaking about Child N in their report, or Baby 14 as it's described, they note the background conditions to this infant and some of the mistakes that have been made and so on. This is another one in which the initial screaming episode was supposedly due to inflicted injury or injection of air into intravenous system. It was alleged that desaturation and bleeding were caused by trauma inflicted by thrusting a nasogastric tube into the back of baby 14's throat. The initial screaming episode is unlikely to be due to inflicted injury because injury of such intensity to cause 30 minutes of screaming would have caused bleeding. It's not due to air embolism because crying due to air embolism is of short duration, is a response to hypoxia as the infant gasps and cries for air and quickly resolves or the infant collapses. Crying is usually associated with discomfort from hunger, hypothermia, hypoxia and pain. The desaturation on day 17 was most likely due to bleeding from haemophilia, either spontaneously or from routine cares causing blood and secretions to pool in the oropharynx. It's one of those two, and obstruct the airway. Moderate haemophilia can cause spontaneous bleeding. It is unclear if a haemophilia nursing protocol was used by the unit to prevent inadvertent trauma from standard nursing care procedures. If it was due to repeated thrusting of a nasogastric tube into the throat, the infant would have cried or screamed and there would be evidence of lacerations in the pharynx, esophagus and vocal cords. None were reported by the intubating physicians. Trauma was most certainly inflicted during the repeated intubation attempts, which aggravated the bleeding and caused epiglottis swelling. In a haemophilia patient, intubation should be performed by an experienced individual. It is inappropriate to allow junior doctors to try and then progress up the chain to senior doctors. The patient should not have been subjected to 8 intubation attempts. The referral to Alderley Hay Hospital and transfer should have been done much sooner, not 11 hours after initial desaturation. Conclusions: crying was not due to injury or air embolism. The subsequent episode of desaturation was due to bleeding, likely spontaneously from haemophilia or routine cares, and exacerbated by repeated traumatic intubation attempts. So there's a couple of key points here. Obviously a very forensic scientific view, but the two things I particularly want to highlight are that this just medically rules out the thrusting of a nasogastric tube into the throat immediately in a very simple way. And then the second thing is that we've seen enormous medical errors here yet again that have, when this has been put to Dr. Evans has said, oh, I considered the fact the babies were infected, or I considered the condition of the unit, or I considered that there were medical errors. Yeah, we just never hear about any of those things in the court case. They were never presented to the jury because they wouldn't have worked for Dr. Evans to be involved in the court case in the first place. So we never actually heard about any of those things. So instead he concocted this ridiculous explanation that Lucy had forced a nasogastric tube down the throat, even though she's not the designated nurse for the infant and there's loads of other nurses around, and there's no actual physical damage, so it's completely inconsistent with that. Of course, the court doesn't hear about any of this. Instead, what the court hears is Nick Johnson saying, oh, she was googling haemophilia, as if that was inappropriate for a child that had haemophilia and they needed to know how to deal with it, and it was experiencing serious problems and they were making massive medical errors on the unit which were exacerbating those problems. So that would perhaps explain why she was googling something. So we will return to the insightful remarks of Nick Johnson. And again, she'd have probably got away with it if she'd stopped there. Other children were perfectly healthy and would have thrived if she'd given them a chance. Is that a fact? Do you know the other children were perfectly healthy? Because there's very strong evidence that that's not the case. And we can't say confidently that they would have thrived because there were children that died on this unit that were full-termers that are not on the indictment, that there's no allegations that Lucy Letby interfered with them and they died on the unit. And there were others who died in other hospitals that were born on the unit in similar circumstances. So to say that they were perfectly healthy when that's not true, and to say that they would definitely have thrived if she'd given them a chance is also not true. I would be inclined to describe that as an outright lie. it's certainly a massive misrepresentation. Moving on. Her ignorance of C-Peptide and the ratio between it and naturally produced insulin led her to think that she could get away with poisoning baby L and baby F. So it's reasonable to say that she wouldn't know about C-Peptide and naturally produced insulin. However, I'm going to be discussing this in a forthcoming video. That is certainly not a definitive piece of science. Mistakes have definitely been made with regard to the assessment of insulin in this court case and the measurement of C-Peptide and naturally produced insulin as described here by Mr. Johnson. So essentially that's just a scientific error. But to suggest that, I mean, I'm not really sure what he's actually suggesting here. He's suggesting, oh, she didn't know about C-Peptide, so she thought she could just poison baby L and baby F. I mean, that's really essentially a ridiculous assertion, because if someone injected insulin into infants deliberately, to suggest that they would assume that there'd be no evidence of that is pretty much an unfounded assertion as far as I can see. I'm not medically qualified and never worked in a hospital, but I would assume if I started injecting insulin into people in significant quantities, that could produce evidence. And yet we know from Lucy's blue post-it note that she believed, way before the police had arrested her, that there was absolutely no evidence against her. Now, why would she believe that if she deliberately injected insulin into feeding bags and deliberately poisoned infants? She would know that there very easily could be evidence against her. And I don't think, as described here, her ignorance of C-peptide and ratios is going to dissuade her from that view somehow. So this is again another nonsensical statement essentially. So we'll continue. What she didn't know was that the disconnection in the ratio between C-peptide and insulin leaves a biochemical footprint or fingerprint which proves foul play. And she'd have gotten away with that as well, ladies and gentlemen, if the police hadn't, as a matter of precaution, referred the cases of baby L and baby F to Dr. Evans. You'll remember he didn't see the cases until significantly after many others in this case. As the suspicion of the consultants grew, Lucy Letby was taken off night shifts and there were no unexplained deaths at night. So there is a few things to go through here. Firstly, referring the cases of baby L and baby F to Dr. Evans is largely relevant because he didn't identify the insulin cases, he doesn't understand insulin, and he barely gave any evidence in relation to insulin in the court case, and the evidence that he did give was categorically incorrect. And later he revealed his ignorance of insulin testing by stating that he didn't even know that mass spectrometry exists. So the kind of presence of Dr. Evans here is not proof of anything, and it wasn't even significant even in the very weak prosecution case. Moving on to the next bit, the assertion about Lucy Letby being taken off night shifts resulting in no unexplained deaths is just untrue. It really hangs on this word unexplained. Now, Dr. Evans has, as we know already, has put together this raft of cases that appear in the court case, and then he's just explained away the ones that don't fit into the pattern that's required to pin everything on Lucy Letby. We know for a fact that's exactly what happened. I've discussed this in other videos. I've discussed this with statisticians. There's a lot more in my book about it. We know this is the case. So to say there are no other unexplained deaths or no unexplained deaths, there can be deaths. The difference is there's been an explanation for them. Actually, there are explanations for the deaths that appear in the court case. It's just not the ridiculous explanations that Dr. Evans put into the court case that have no scientific merit whatsoever. So we'll move on to the next paragraph. She went on holiday to Ibiza in June 2016, and when she got back, she embarked on a killing spree. That's not a fact. That's just an assertion. That's not a fact. Baby P and baby O murdered in quick succession, followed by an attempt to murder baby Q, all within 3 days of her return to work. Again, we don't know. We don't know that's the case, so you can't say that with any confidence. And when she thought she was rumbled, or at least that the suspicions were growing significantly, she did her best to create the impression that the neonatal unit was dysfunctional by putting in false data sheets. I will return to them, but you will remember, won't you, the baby O one dated the 30th of June that Dr. Breary said in effect was a lie. So we're now going to examine that particular claim. Now, despite my best efforts, I can't find any reference to this supposedly inaccurate data sheet anywhere. I've tried to look through the court transcripts that are available. I've tried to look through the court reporting. I've tried to look through other records. There's no reference to it. Nick Johnson may be referencing another claim related to child P, seeing as at this point he is dealing with several infants at the same time. As you probably noticed, we've barely even discussed child E so far, because he goes around trying to draw associations between various things that happened in this rather labyrinthine prosecution case. What we should say about child O is that this was the infant that Dr. Stephen Breary has played a part in a major medical error with accidentally piercing the infant with a needle. This is mentioned in the panel report here. There's a lot of discussion. I'm not going to go over all of this, all the background to the infant. This infant had a subcapsular hematoma, and there were problems with the way that it was ventilated, and there was a laceration that occurred as well. I'm not going to read out the whole thing, so I believe I read it out in previous videos. It's well known, pretty well known. It's probably the most well-known case in the court case by now. Well, bear in mind, Dr. Stephen Breary is implicated in this error, and yet he's the person in court saying, oh, Lucy Letby made an error on the data sheet. And then there's a couple of other notable things that we need to discuss about Dr. Breary with regard to this case as well. So firstly, with regard to child O, it was discussed in court that there's no record of a doctor's examination after the nurse Sophie Ellis had noted a doctor reviewed child O, while Lucy was blamed for noting a doctor review for child A when there's no record of a doctor's examination. So this was seemingly an error of notification made on the unit by consultants, who are now accusing Lucy of making some sort of data error, although this was such a minor point in the court case that it appears to pass by without being referenced anywhere. It may have been in a statement from Dr. Breary, but it was barely discussed in court, if it was discussed at all. The second thing is this is during the questioning on child O, and it's Dr. Breary that's made these allegations. Nick Johnson is citing Dr. Stephen Breary. Ben Meyer says to him, if somebody hurt a baby on your unit and you believed you had the identity of the person responsible, you'd report it to the police, wouldn't you? And Dr. Breary says, I think you are making it a bit more simplistic than it was. It was not something that anyone wanted to consider, that a member of staff is harming babies. Now, that is such a blatantly dishonest representation of the situation of what occurred on the unit that it's quite staggering. I can't go into the full details of that at this point in time, but that does not give a realistic impression of what his attitude was and what occurred behind the scenes with the consultants. So in this moment that flashes by in court during this closing statement, we firstly have an allegation that is deemed to be of considerable significance by the prosecution, but that was barely even mentioned in court. It's made by Dr. Stephen Breary, who actually was part of some very serious medical blunders with regards to this infant that was also suffering with a subcapsular hematoma that is clearly far more likely to have been the underlying factor that caused problems for child O than Lucy Letby failing to fill a data sheet incorrectly, supposedly. And then the third thing is Dr. Breary has made these very disingenuous remarks during cross-examination on child O. So I know that people that believe Lucy Letby is guilty like to accuse her of lying in court and making statements on the witness stand that were inaccurate. I'd like those people to go away and consider this statement from Dr. Breary, and if you've been through every single document of the Third Inquiry, as I have, you will realise how disingenuous this remark from Dr. Breary truly is. So Nick Johnson continues, you'll remember the JA Datix sheet put in the same day referring to a missing bong on a line that in a text message she said created the danger of an air embolus. What are things to be pointing out just as you feel that you have been rumbled for administering air to these children, ladies and gentlemen? Get your defence in first. That's exactly what she was doing, isn't it? The effort that Lucy Letby put in on the 30th of June has continued through this trial, hasn't it, with the non-specific and general suggestions of incompetence or short staffing. So there are several things to deal with here. This firstly returns to the theme that we saw in the first part of this closing statement, in which the prosecution suggests that Lucy Letby has to provide an explanation for everything that occurs on the neonatal unit, which is obviously palpably ridiculous. And then again, there is some. We know already. It's already been established that Lucy was the most diligent completer of Datex information on the unit. Everyone agrees with that. That's not open to debate. So this Datex sheet reference is referencing something from the court case that we could go into, but so many of these assertions are based on the idea that she fabricated things, but there was actually no evidence for that. It was just something that the prosecution made up as a narrative. I may go into this as this continues, but as it's going to take an enormous amount of time to go through this closing statement and respond to everything, I'd rather just continue at this point because he will return to some of these topics later on. But for the reasons I've explained, despite her saying there were problems, there is no evidence of there being problems. So we now know this statement to be so farcically untrue as to be absurd. There is considerable evidence of problems. There's problems with understaffing. There's problems with a lack of skills. There's problems with overcrowding. There's problems with acuity. There's problems with medical errors. There's problems with sanitary issues. There's problems with bacteria circulating. There's problems with endemic sepsis. That's just 8 things. Oh, transportation, I forgot to mention. There's a problem with transportation issues. There's problems with infants being ferried around from one hospital to another when this really shouldn't be occurring. This unit shouldn't be dealing with babies of this gestation. This unit was to be downgraded and still hasn't been upgraded. Those are 12 problems just off the top of my head in a matter of seconds. So there is considerable evidence that there were problems on this unit. To say there was no evidence of problems is just... It would be generous to describe it as a misrepresentation. I'd say it's just an outright lie. Of course, the jury didn't get to hear about any of the problems or a lot of the problems, so they weren't properly discussed in court. But there's overwhelming evidence of problems on the unit now. I said earlier that we're not going to deal with the case chronologically, and the reason for that, we suggest, is that there are things that are beyond any sensible debate. I mean, we certainly don't see an enormous amount of sensible debate in this court case, I'll agree with that. Things that we suggest you are very likely to accept, starting with things that are agreed, or at least are not disputed, can be very revealing, not least because you can take them into account when considering cases further down the line. So I'm going to start with things that we suggest fall into that category and see where they lead us in terms of interpreting the rest of the evidence in the case. So I'll just point this out very briefly. So he says these things are not disputed, but then he's saying we suggest these things fall into this category. So that's immediately a conflict between the two. So we can immediately assume that the things that he's now going to state as being not in dispute actually could be disputed because some of them are only being suggested. So this is when he finally moves on to babies E&F and babies L&M, which they kind of try to lump together because they're twins without ever explaining the fact that twins are more vulnerable. I will start by, in effect, taking 4 cases together. We're going to start with the cases of, as I said earlier, I think, the babies E&F twins and the twins L&M. There were 2 sets of twins born several months apart. Their cases have important similarities. One of each pair was poisoned with insulin. So it's true to say that child F and child L were insulin cases. It's not true to say that they were poisoned with insulin because actually the medical evidence doesn't support that. So it's just yet another medical error and kind of unfounded medical assertion made in this closing statement. I should emphasise as well that there are very rarely in this court case any mention of the fact, as I say, that infants are more vulnerable when they're twins, etc., etc. So we'll continue. So unless you conclude that the poisoning was accidental, a possibility that we suggest you can dismiss, unless you conclude it was accidental, you know that somebody was trying to kill them. So essentially, this is a false equivalence. What Nick Johnson is suggesting here is either these infants were poisoned deliberately or they were poisoned accidentally. They were poisoned 100% is what he's saying. And he's saying you have to decide, was it all a mistake or was it done deliberately? Which is a false equivalence because actually they weren't poisoned at all. The other twin in each pair was attacked with air. What are the chances of that? Well, I mean, that's a fairly banal statement. There's no real significance about the fact that these are twins. In fact, it would have made, as Nick Johnson has rightly pointed out, these attacks are months apart. If there are two attacks on two infants at one time and then two attacks on other infants at another time, it would make more sense to have the same method of murder across the attacks. In fact, saying the chances of that are slim. I mean, he's saying like it's an inevitability that this has occurred, when in fact the complete opposite is the case. The allegations of attack and the allegations of destabilization made by the prosecution actually don't make sense. It would make far more sense if the same method of destabilization was used across all four infants, or certainly if the same method was used at the same time on the infants that were allegedly attacked at the times indicated. So what he's trying to pass off here as sort of something that is undeniable actually makes no sense whatsoever. Indeed, he points out in the very next comment that these are 7 months apart in the same unit. So looking at baby E, the twins were born on July 29, 2015, which was Lucy Letby's day off. Between then and the events you've heard about, Lucy Letby had looked after baby F several times. By the events that we are concerned with, both twins were doing well. You'll recall that the mother of baby E and F was an inpatient at the hospital as well, and it seems like a long time ago now, but it was the 14th of November last year that the mother of baby E and F gave evidence. Now, I just want to be clear at this point that I've said previously, and I'll say again, I don't think the parents should have been involved in this court case. I don't think they should have been called into the witness box, and I don't think they should have been entitled to give eyewitness testimony. It's a traumatic event for them to go through, and it has no evidential value whatsoever because they didn't provide any meaningful eyewitness information. They didn't see Lucy Letby do anything wrong. So there was no value in that. They don't have any medical qualifications, so they couldn't provide any useful medical information. And when you look at the medical information related to child E and child F, it's highly complex, and it's doubtful whether they would even fully understand it now, let alone at the time. Thirdly, they're probably the worst and least reliable witnesses in the world because they've witnessed an extremely traumatic event and they've been involved in an extremely traumatic event involving their own children, in which their children suffered extremely difficult medical complications. Now, it's almost impossible for them to be objective about this. The only justification for calling them into the witness box would be if they had some sort of material evidence or concrete information that had some relevance to the court case. You know, if they'd specifically seen Lucy Letby harming one of the infants, or if they'd seen something that pointed to a guilt in any sort of meaningful way, then it may have been justified to include them in the court case. It probably would have been justified. As that doesn't apply to any of the parents in the court case, not just the parents of child E and child F, it applies to every single parent. There's simply no reason, no justification, no evidential value in including them in this court case. The only reason they're in the court case is to give emotional testimony that swayed the jury. And credit to the prosecution, it worked, if their job is to prosecute, which I suppose you could argue that it is. But if we're talking about trying to get an objective investigation and scientific and medical investigation into what actually occurred on the unit, then it was a terrible thing to include in the court case, and it should never have happened. And I think that's particularly true considering it would obviously have been very emotional, very painful, very traumatic for them to give evidence in court. So you're just hurting the parents for absolutely no reason for something that has just created it's made the conviction even more unsafe than it would have been anyway. So I am a critic of that, and I'll continue to be a critic of that. People have complained about that in the comment section, people that consider Lucy Letby to be guilty. Well, unfortunately, no one was able to put forward any rational arguments, so I will continue to argue that, and that's all there is to it. Move on to the next section. She started with the events of the July the 30th, 2015, when she'd been able to visit her sons and have a cuddle with baby F. The mother of baby E and F, we suggest, was a very, very important witness in this trial, so I've just debunked that completely, but we'll continue. The mother of baby E and F, we suggest... Oh, sorry, so that's a... No, I think... Maybe that is a transcription error. I do apologise for that if it is. And she told you a number of very, very important things, so you say. What she said was that providing milk to her sons was top of her agenda. She felt it was the only thing she could do for her boys. She said that on the 3rd of August at 2100 hours, she went down to provide that milk. She said that when she entered Nursery 1, baby E was crying, and it was like nothing she had heard before. To quote her, she said, "It was horrendous, more of a scream than a cry. You'll remember baby I and baby N, won't you, ladies and gentlemen, and that look of shock on Dr. Lothan's face when she saw she had written screaming of baby N on the 3rd of June 2016. The mother of baby E and F said there was blood around baby E's mouth." So there are quite a few things to deal with here. Eventually we're going to deal with the actual alleged time that this has occurred. But the first thing to say, I've already mentioned the fact that parents are not going to be the best eyewitnesses of these things. But she says here, when she entered Nursery 1, baby E was crying and it was like nothing she had heard before. Now, I don't know much about these parents, but this could easily have been the first time they've ever had children, and it could be the first time they're around young children. So the fact that baby E was crying and it was like nothing that she had heard before is not in itself particularly surprising. However, it could have been significant, but it doesn't indicate anything medically or evidentially. All that it is really indicated is that baby E was in distress, and we now know the reasons why baby E was in distress, which I will discuss before the end of this video. But it doesn't naturally follow. They're trying to create a pan. I mentioned this the other day. It's another error of human reasoning, subject to bias and misaligned thinking. Is this notion of a Pavlovian association. It comes from Pavlov and the dogs, with Pavlov ringing the bell and the dog salivating even though they're not going to be fed because he conditioned them to think that way. So what the prosecution is trying to do here is create a similar Pavlovian association between traumatic events on the unit and Lucy Letby having caused them, even though there's no causation here. This is just correlation. The baby was crying, Lucy Letby was around. That doesn't mean Lucy Letby is attached to the infant. All it means is that the infant was experiencing a traumatic event. And it's absolutely true. I'm sure for the parent this was horrendous, but that really has nothing to do with the medical picture of this infant. There's discussing of baby I and baby N as if they have cried and screamed, and therefore we can assume that it was the same method of collapse and the same method of attack from Lucy Letby. But I mean, this is just spurious. It's just an assertion that is without foundation. It's true, and it's accepted by Lucy Letby, and it's accepted by eyewitnesses that there was blood around the mouth of baby E. No one disputes that. So that is a reasonable thing that has been introduced into the court case by the parents, but no one disputes that anyway. Lucy Letby hasn't denied that was blood around baby E's mouth. None of the doctors have, none of the people who were present have. We know that there was blood around the mouth of baby E. That doesn't mean anything. You'll remember what I described more than once as a goatee beard type image on that picture. Lucy Letby told the mother of baby E and F that the blood had come from the nasogastric tube and the registrar was on his way. On his way, repeated for some reason. Lucy Letby told the mother of baby E and F to go back to the postnatal ward, and by 21:11 hours the mother of baby E and F was back on the postnatal ward. There's no room for misunderstandings here, is there, ladies and gentlemen? This is a head-on credibility contest between the mother of baby E and F and Lucy Letby. That's why Lucy Letby's lies about something as trivial as a social life are so important. A full-on head-on credibility contest, and you can be sure that Lucy Letby is lying about this incident, can't you? So we're going to move on to actually assessing this in a second because this is critically important. But you see what the prosecution is doing here and has done throughout this court case. And this is what prosecution barristers do all the time and are doing in court cases up and down the land as you're listening to this right now, is they try to assassinate the character of the witness. They try to make out the witness, the defendant, is a liar, and they've by their own admission, they've used trivial things that have occurred in her life, trivial details that actually she's not even lying about them. Like, this is one of the ironic things. As I mentioned earlier, we know from the Thirlwell inquiry now that way back at the start of this passage, I say way back, we haven't even got that far yet because there's so many misrepresentations. It takes so long to go through a small passage. But at the start of this particular passage, we saw Nick Johnson introducing this comment and this assertion about her social life and about her access to the unit and about her access to her colleagues on the unit. We now know that what Lucy Letby said in court is true because it's come out in the Thirlwell inquiry that it was true. So we know that for an absolute fact. So he's talking about this being a head-on credibility contest. Nick Johnson is hanging this entire section on something that he has asserted as being a lie that we now know to be true. So that's a very critical point straight away. The timings are also going to be very important, as we'll find out in the next section. But so far, we're quite a way into this, and if you go back and look at the previous section, the closing statement, it's exactly the same. We're possibly 5,000 words into this, so a good 5% into the speech now. This would have taken quite a long time to go through via speaking. I think usually you speak about 150 words per minute, but you might be speaking a little bit slower than that. So this might have taken half an hour. Notice how flimsy the actual evidence is by this point. He's been talking for half an hour. We've not seen any evidence at all, really, of any significance. And he's hanging so much on this assassination of Lucy Letby's character of asserting that she's a liar. And now he's going to use the fact that she's a liar to say, you now have to believe the account of the parents over her. And that is the sole piece of evidence related to Child E, and it certainly is used as a critical determining factor. And that's crystal clear, that cannot be denied. So Mr. Johnson continues. Because plainly, as any parent will understand, the provision of milk, food to a newly born infant is important. So this is a statement I can actually agree with. This is 100% correct. Of course, it's a statement that has absolutely no significance to this case whatsoever. And 2100 hours was baby E's feeding time. If we just look at tile 121, please, of the baby E sequence, you've got this in hard copy as well, crying like nothing I'd heard before. It was a sound that shouldn't have come from a tiny baby. So I've already addressed this, so I won't address it again. It was horrendous, more of a scream than a cry. You may think, ladies and gentlemen, and we invite you to conclude, that the mother of baby E and F would have a very good reason to remember this. So she will remember it. I don't think anyone disputes the fact that she has remembered something, although even false memories can be created in traumatic scenarios. So that couldn't be ruled out entirely, although it's not very likely. But the point is not whether or not she remembers it. It's the significance that the prosecution is attaching to this memory and the assertion that this memory is entirely accurate, which is not very well founded because it's a highly traumatic event by someone who's hugely emotionally involved, who has no medical qualifications. So we have to question the validity of this particular observation. The prosecution immediately says it was the night her son died. Of course she's going to remember it, but the night that your son dies in traumatic circumstances is going to be entangled with all manner of complex emotions, obviously. So that makes the testimony significantly weaker. Plus, obviously, as mentioned, the parents really have no experience of this situation. So their testimony should be viewed as highly questionable. I don't say that to be disrespectful, but it's just simply a fact that if you have someone who's unqualified, who's never been in these circumstances before, and then they're put in a highly traumatic situation that is extremely personal to them, their recollection of that event is not very likely to be accurate, and it's very unlikely to have any evidential value. Either the mother of baby E and F saw blood, or she didn't. She got it wrong. Why would she make it up? If the mother of baby E and F saw blood at 9 p.m., then Lucy Letby's nursing notes are false. So this is a critical point. Firstly, no one denies that there was blood. So what Johnson is doing here is trying to create a conflict or a demarcation between the prosecution and the defence by saying the mother is honest, the mother saw blood, and somehow Lucy Letby has denied this. And then secondly, this time of 9 p.m. is significant. So I'll get onto that shortly. It's difficult to say precisely when the correct time is to look at the 9 p.m. issue, but I just want to go on a little bit further first. Note that the prosecution entirely relies on this assertion to make the comment that Lucy Letby's nursing notes are false. And this is something that is then repeated over and over again. This is really the only concrete example that I have found where this allegation that is repeated several times in the court case that Lucy Letby has falsified things or fabricated evidence, this was the only concrete example where the prosecution could point to something and say, look, we actually have a case for why these notes are false. In all other instances, when they say Lucy Letby has falsified something, that was just a supposition. I say it was fabricated, if you want to use a lawyer's trick. I say that they just fabricate that evidence. They could say, well, we supposed that it was the case. Either way, there was nothing of solidity to support that. And this assertion here is critical. This is why it's being placed at the forefront of this closing statement. This is all very strategic, it's all very tactical, it's all been thought out very carefully. The reason they're placing this right at the start, and the reason they're placing such undue emphasis on this incident, is because they're using it to say, look, we have established that Lucy Letby falsified nursing notes, so now, after that, we're going to go crazy and say she did it over and over and over again, and use this as the precedent. You know, the legal system loves precedent. They seem to be obsessed with precedent, as if once something has been established by precedent, there can never be a new understanding of the circumstances that surround it. But in this particular case, what they're doing is saying, Lucy Letby denied that there was blood. That's not true. The mother saw blood at 9 p.m. As we will see, that account is probably incorrect. And therefore, we know that Lucy Letby falsified her nursing notes. Well, that is a false inference that's been made from information that is incorrect and unreliable, essentially. And what the prosecution is trying to do here is present this raft of unreliable information that follows one after another, and they're just presenting it as fact, or presenting it as reliable or undeniable, which isn't the case. So he continues, you've got them, ladies and gentlemen, in a hard copy behind Divider 5 of Jury Bundle 2. Either Lucy Letby told the mother of baby E and F that it was a nasogastric tube which had caused the blood, or she did not. Now, again, this is the prosecution requiring Lucy Letby to provide an explanation for blood. So remember, Lucy Letby has not denied that there was blood. She has acknowledged that there was blood, and she has tried to give an explanation for why this has occurred. But it's not, even for a doctor, doctors have made diagnoses in this case, and doctors have made assertions on the unit that we know are either categorically incorrect or very likely to be incorrect. So even people that are paediatricians, that are registrars, that are trained, that have worked in a hospital environment as medics for a sustained period of time, even they will make medical assertions in these complicated cases where things are happening very quickly and they've got to make snap decisions. They will get things wrong, and they did get things wrong. We know that for a fact. So to expect a nurse, and bear in mind this is a relatively inexperienced nurse, to expect her to come up with medical explanations for why things are occurring, when, as we've seen in previous videos, I'll go through things on ChatGPT, and you'll see there can be all manner of medical explanations for certain symptoms. So an incident of bleeding of this nature would have less possible medical explanations, but there would still potentially be several causes, and some of those causes may be very obscure. To expect Lucy Letby to give an explanation for why the blood is occurring is not reasonable. But again, this is just part of the overall prosecution strategy of saying you either have to believe Lucy Letby's account of events or you have to believe our account of events. It's creating this demarcation, this conflict between the two, and saying you have to come down on one side or the other. It's trying to make it into a black and white issue to make it more likely that the jury will come down on the side of the prosecution. So I'll just continue with the next paragraph. Why would the mother of baby E and F make that up? Dr. Bohin told us that the records show that the nasogastric tube that was in place on the 3rd of August was the same one that had been inserted on July the 29th. So the same tube had been in for several days, and that was never disputed. Well, Lucy Letby would have known that at the time, wouldn't she? So why did she say that it was the nasogastric tube that had caused the bleed if it was the same one that had been in there for so long? So there are a couple of things to say here. Firstly, I'm not sure that it's very well founded medically to say that because a tube was inserted on a certain date that it couldn't cause bleeding at a later date. So a medic would have to assess that, and I may look at that in a second. But the second thing is this continues the theme of just requiring Lucy Letby to give an explanation for what has occurred with this bleeding, when that is essentially completely unreasonable. And if we had seen what should have occurred in this court case, which is there should be dozens of medical experts in there saying the prosecution case is completely wrong, the evidence is completely wrong, this is what actually happened, then you would see that none of this entire prosecution statement, if we had the now 26 experts, neonatal experts, pediatric experts, there are nurses in there, endocrinologists, experts across multiple fields that are world class, that are way above the level of anyone that appeared in court, let alone the concocted theories of Dr. Evans, this entire prosecution speech would become impossible. They wouldn't be able to do this anymore. They'd have to do something completely different. All of this is really predicated on the fact that there weren't experts in court to explode several, if not, several is probably not putting it strongly enough, the multiple, numerous, almost innumerable myths and poorly founded arguments and misrepresentations that form this prosecution case. You will note how long it's taken me to get this far, because we never encounter a paragraph where I say, oh, well, that's all correct. You're supposed to look at the court transcripts. This is what pro-guilty people say, and then you're supposed to be blown away. Everything that we believed to be the case about Lucy Letby being innocent and this being an unsafe conviction, this is supposed to be exploded by the prosecution case. We're supposed to look at this and have no explanations or no answers, when in fact we see the complete opposite. We see that this is very poor, it's extremely poorly founded, it's full of mistakes, it's full of misrepresentations, it's full of things that we now know to be incorrect. And if there had been medical experts in the court case, this would have happened at the time. So I just want to go over this briefly, just to show you that these dogmatic statements that are made in court and by the prosecution, and indeed by expert witnesses, are poorly founded. So I've asked ChatGPT this question: if a nasogastric tube was inserted incorrectly into an infant or in an uncomfortable manner, would this necessarily result in bleeding immediately, or could this bleeding be delayed so that it only manifested several days later? If a nasogastric tube is inserted incorrectly or in an uncomfortable manner in an infant, bleeding typically occurs immediately or shortly after the insertion, especially if there's trauma to the nasal passages, pharynx or esophagus. However, delayed bleeding is also possible, though less common. Here's a breakdown of what might happen. So I'll just move on to the delayed bleeding section. Delayed bleeding, possible but less common. Delayed bleeding could occur hours to days later due to ulceration or pressure necrosis. Continuous pressure from a poorly positioned or rigid tube can cause localized tissue injury. This may lead to ulcer formation, especially if the tube is left in place for an extended time. Bleeding could start several days later once the mucosa breaks down. Infection. Trauma may predispose the injured site to infection. An inflamed or infected area could bleed later due to tissue breakdown. Movement or dislodgement. If the tube moves or is inadvertently pulled or twisted days after insertion, it could cause delayed mechanical injury and bleeding. Of course, in this court case, we have to pretend that the only reason a tube can ever become dislodged or move is due to Lucy Letby removing it. But typically, in other hospitals, it's possible for tubes to become dislodged accidentally. Clinical considerations. Any new bleeding from the nose or mouth days after the nasogastric tube placement warrants evaluation, even if the initial placement seemed uneventful. It's important to remember as well that there are numerous problems with the placement of tubes on this unit. Now, we know this from other cases. Signs of distress such as feeding intolerance, coughing, respiratory changes, or irritability may indicate a problem with tube placement or complications. So, bleeding from a nasogastric tube insertion is usually immediate if caused by insertion trauma, but delayed bleeding is possible due to ulceration infection or later mechanical injury. Any such bleeding should be taken seriously, regardless of timing. So, I'm going to go over now what the panel said about Child E, but this just shows the comments of Lucy Letby that bleeding could have been caused by the insertion of a nasogastric tube. That is credible. That is possible. We don't know whether or not that occurred, and as I say, I'll go over the panel's conclusion. But the point is that the way Nick Johnson is presenting it, this tube was inserted several days ago, so there's no possible way that it can have caused bleeding. Again, they're just simply a factually incorrect, medically illiterate statement, essentially. So now that we have an idea of what the prosecution has claimed in court with regard to Child E, let's have a look at the panel's verdict. So I'm going to read out the whole verdict and look at the circumstances of this infant firstly, because that's important. So Child E was 29 plus 5/7 week, 1,327 grams birth weight, twin 1, male infant, who was born by semi-elective caesarean section for twin-twin transfusion system with oligohydramnios. So, a few things to note here before we go any further. The first thing is this infant could not be born in the Counts of Chester now since it's been downgraded and wouldn't have been able to be born there at any time over the last 10 years. It's actually 9 years to be completely accurate. So this child would now be born at a different hospital. It's significantly premature, pretty low birth weight, just weighing 1.3 kilograms. A twin, so more vulnerable. There are multiple, born by semi-elective caesarean section. There's twin transfusion system. Clearly, you can see immediately this is an infant with significant problems. That's undeniable. If this infant receives optimal care, it's still a vulnerable infant. So if this infant does not receive optimal care, then he naturally faces, it's treacherous for his existence. I think it's fair to say. Antenatal ultrasound showed dilated small bowel loops and absent reversed end diastolic flow. Child E required bagging at birth and continuous positive airway for apnea. He showed signs of infection with low white cell and neutrophil counts and high blood sugar, which were treated with antibiotics and insulin. Chest x-ray was clear. 4 days later, he developed respiratory distress, desaturation, chest recession, oxygen need, and bilious aspirate from the nasogastric tube, but the abdomen was soft and not distended. So let's just stop there for a second. So note that all of the observations that are made here are just consistent with what I just read out from ChatGPT. So the signs of infection, there's problems with the nasogastric tube, there are respiratory issues, literally everything that ChatGPT just referenced with regard to bleeding. However, I'll continue. He had 2 episodes of massive gastrointestinal bleeding with at least 25% of estimated total blood volume aspirated from the nasogastric tube. He was given normal saline, but 40 minutes later he suddenly deteriorated with desaturation, poor perfusion, low heart rate, and purple patches of discoloration over the abdomen. An hour later he collapsed again and died despite resuscitation efforts. So, do you see the difference between what is being expressed here and the way that the prosecution has presented this? The prosecution has presented like everything was absolutely fine with this infant and then it just suddenly collapsed for absolutely no reason, when this was the actual medical picture. And we also see the assertions made regarding the nasogastric tube, regarding the respiratory condition of this infant, were vastly different from the actual medical picture of the child. So this is one example of numerous, endless I would say, instances in the court case where the jury should have heard a certain medical picture and they actually heard something completely different. They gave them a completely false impression of what occurred. If they'd have heard this kind of thing, if Dr. Evans had actually given them a realistic clinical overview, and if he'd actually, as he claimed, taken into consideration the numerous things that he should have taken into consideration but never did, because his job was to concoct some theories that would get the case to court, then, which is clearly what he's done, then we'd be looking at a very different scenario. I mean, you look at the court cases, you look at the cross-examination of Dr. Evans, you look at what the prosecution said in court, there is no evidence whatsoever that he ever seriously considered any errors on behalf of the hospital, the true clinical picture of these infants, and all of these type of incidents with, failures of intubation, problems with nasogastric tubes. Those are just two examples. There are many, many others. We see a catalogue of medical failings across these cases that have now been documented. But when we look at we would be hearing about these in the prosecution case, wouldn't we? Dr. Evans is an expert witness. Dr. Evans is supposed to give an impartial view. If Dr. Evans had mentioned all these things or spoke about all these things or accounted for all of these things in the evidence that he presented to the court, the prosecution case couldn't be expressed in the way that it is, because the defence would just stand up and say, yeah, but we heard about the nasogastric tube, we heard about the distress this infant was in, we heard about this, we heard about that. The defence has obviously attempted, without calling medical experts. I think there was some good efforts from Ben Myers in court, even though overall I would be critical of the defence and the defence strategy, and perhaps what solicitors have done as well. But it just wouldn't be possible for Nick Johnson to stand there and say, well, the nasogastric tube was inserted, everything was absolutely fine, when we can see that that is just an absolutely ridiculous account of what has actually occurred with this infant. So we'll continue with the panel. It was alleged that Child E died from inflicted trauma causing upper gastrointestinal hemorrhage and intravenous injection of air causing air embolism resulting in collapse, patchy discolorations of the skin and death. So now we have the opinion of the panel. Child E was at high risk because he was preterm, had twin transfusion with oligohydramnios, and his antenatal ultrasound showed reversed end diastolic flow and dilated small bowel loops. So just repeating really what I think anyone can see quite clearly, that this is a vulnerable infant. This is a high-risk infant. I think this is undeniable. I don't even think you really need medical qualifications to see that. But obviously, for highly qualified neonatologists, they're going to cite that very quickly. This meant blood was being sucked out of the fetus at the end of each cardiac cycle, and the intestines were likely damaged before birth. The two episodes of massive gastrointestinal hemorrhage were most likely due to in utero hypoxia causing stomach or small intestinal ulceration. Remember, in the ChatGPT comment that we just read through, they said bleeding can be delayed due to ulceration. What are the experts saying here? In utero hypoxia is causing stomach or small intestinal ulceration. So they're not citing the nasogastric tube, but they're citing conditions surrounding what can cause bleeding from a poorly positioned nasogastric tube if the kind of suboptimal medical conditions exist. And erosion into an intestinal blood vessel or to a vascular abnormality such as Dielefoy's lesion, I believe that's pronounced, which can cause life-threatening hemorrhage. His 25% blood volume loss was likely an underestimate because more was likely lost in the intestines. Emergency transfusion with Group O negative blood should have been given immediately should have been immediately given earlier during resuscitation. Since 20% blood loss causes shock and Child E lost much more, this was fatal. Patchy skin discolorations are caused by dilation and contraction of small blood vessels in the skin in response to hypoxia, which can occur in many conditions and are not diagnostic of air embolism. Zhu and Lee reported that non-specific localized patchy skin discolorations have not been reported in infants with venous air embolism, including intravenous air injection, and that only Lee's sign and Liebermeister's sign are diagnostic of air embolism. If air was deliberately infused through a central venous line to cause air embolism, the line will have to be reinfused with fluid to prevent detection. collapse from air embolism occurs instantaneously, it is doubtful that this can be achieved quickly enough before other staff in the unit responds to the collapse. So just on that last point, this is one of the many areas in which the logistics of the Lucy Letby case and the allegations made against her make absolutely no sense, in which they're likely to be logistically impossible. I want to make a standalone video looking at all of the instances and all of the various ways in which the prosecution case simply makes no logistical sense whatsoever. But overall, if we look at that statement, you can see that the clinical picture relates to the infant is completely different to the way that it's been presented by Nick Johnson, the barrister and prosecutor in court. And you can see how the jury can get a completely wrong impression of what has actually occurred on the unit. So in conclusion, Child E has died from massive gastrointestinal hemorrhage due to either intrauterine hypoxia causing stomach or intestinal ulceration or a congenital vascular lesion. Massive mistake is that emergency blood transfusion should have been given much earlier, and this was indeed discussed during the court case. There was no evidence of air embolism, and a post-mortem should have been requested. So again, the parents of Child E and Child F were advised that there shouldn't be a post-mortem because they wouldn't have learnt anything from this. So this is an infant that could have been... We could now have a post-mortem verdict on this infant to refer to. Of course, that wouldn't prevent Dr. Evans from overriding the post-mortem and overruling it with his crappy case note review, but at least we'd have the post-mortem there so that rational people can look at it and see that what is likely to have occurred to this infant. The important thing to note really is that as we go over the prosecution case and as we go over this prosecution closing statement, all of the assertions that are made in relation to these infants are so simplistic and basic, for want of a better term, that when we look at actual medical information from credentialed and qualified people, we see how much more specific and forensic it is by comparison, and how tenuous and specious the prosecution case is. So we're supposed to look at this prosecution case and be convinced, but when we actually have contextual information about this infant, it becomes clear how weak and how poorly founded and how dubious the prosecution case actually is, and that they're just relying on this very strangely interwoven, concocted series of assertions that when you actually place them under the microscope, they all fall apart. And that's before we even examine the assertion that this incident that the prosecution have referenced definitely occurred at 9 p.m, which we're going to do now, and as we'll see, that is simply not true. So with regard to the call times, I have written here that there are also problems with telephone log times submitted in court. This has been discovered and flagged up by investigators working diligently on the case since the verdict. When the events surrounding Child E are examined in detail, the only rational conclusion is that calls made to Child E's father were an hour later than stated by Cheshire Police and the prosecution in court. This was critical because the mother of Child E stated that she witnessed blood around the face of the infant at around 9 p.m. Notes made by Letby recorded this event as occurring at approximately 10 p.m, and the notes of Dr. Hartness were recorded at 10:10 p.m, shortly after the doctor arrived. The midwife on the unit called the father at 10:52 p.m, requesting for his presence at the hospital, but clinical notes recorded that the condition of baby E didn't deteriorate until after 11 p.m, and it was at 11:30 p.m. that the midwife received a call from the neonatal unit indicating that they were preparing to intubate. In support of this, statements to this effect were read out in court. The only way to reconcile the call log times with other records is to shift the call log forward by 1 hour, meaning that Letby acted exactly as she should have done. This error was pointed out by John Sweeney in his excellent podcast series with Edward Abel Smith on the Letby case. When interviewed by Sweeney, Dr. Evans seemed rather nonplussed by this revelation, but considering he didn't even know about the sewage that was discussed in court during the court case for which he was by far the most important witness, perhaps we shouldn't be hugely surprised. So just to add to that as well, that this hour discrepancy can come about due to the shifting of clocks that obviously occurs in the spring and autumn in this country. And we'll see later as we return to the prosecution statement that they actually corroborate some of these times in the closing statement of the prosecution. And once you see that, it becomes clear that the prosecution case actually makes no sense. And the the dots just don't join up correctly. It's as simple as that. So we're now going to go over quite a lot of medical information related to child E. And the very first statement comes from this witness statement from the Thirlwell Inquiry, INQ 0107824, from Belinda Williamson. This was yet another statement that was submitted late by the Thirlwell Inquiry and so wasn't part of the public inquiry. So she said, I have been asked whether child E's collapse and death was an unexpected event. Any child being cared for in a neonatal unit is at risk of a collapse. As if they were well, they would not be on a neonatal unit. I did not feel that child E's collapse and death was an unexpected event, as during my career I have seen infants who appear stable collapse and die very quickly. So this is in complete conflict with what the court heard, both specifically in relation to child E, but also generally in terms of the assertion that infants had just simply collapsed for no reason, when in fact infants do collapse with some regularity on these neonatal units, even when they're fully functioning and optimal, which we know this one was not. So that just introduces the idea that child E was vulnerable and was at risk of collapse. And as you'll see as this medical information unfolds, that was very clear and can't really be contested. So we'll move now on to the Chester Standard newspaper for 15th of November 2022. And there's some important information here that occurred in court in relation to child E. I do have the transcript for this, but it's kind of easy to go through this court reporting as a summary. So Ben Myers speaks about child E and is interviewing one of the nurses on the unit, and she immediately agrees that child E was premature, there were risks associated with that, and that there were numerous other risk factors for this infant. Twin births also add risk, so this was actually an occasion where the fact they were twins and that made them more vulnerable was actually mentioned here, and that there were numerous reasons that child E could be vulnerable to health complications. Earlier in the day, Ben Myers was interviewing Dr. Christopher Wood. He said that there were potential complications for these twins, and also noted that there was understaffing on the unit and duties were split between the paediatric to maternity units. Now, that's very significant and important because timely intervention can be the difference between life or death in these circumstances. So if you have duties being split between various units and various doctors, it's not a good thing, of course. And then just before this, Ben Myers asked Dr. Wood about the loss of blood, and he states that if a neonate loses a significant quantity of blood, it's very different from an adult losing a significant quantity of blood, because there's time to seal a gastric bleed in an adult, but not necessarily in a neonate, and Dr. Wood simply agreed with this. And then earlier than this, it's noted that the clinical details for child E indicated that the infant was suffering with a GI bleed, it's gastrointestinal bleed. So there was very strong evidence of this gastrointestinal bleeding, and I will present this throughout the remainder of this section. So we'll move on now to the witness statement of Jane Tompkinson, INQ 0017159. And she noted that a Datex incident was reported in relation to the unexpected death following GI bleed, gastrointestinal bleed, of child E on the same day. This should be available to us because they're referencing this INQ 00142002, but I cannot find this document. I've tried to get hold of this document, but I think it has just been suppressed. It certainly does not appear to be available online, but that was the Datex for child E, in which it is noted that there is strong evidence for gastrointestinal bleed, and Lucy Letby reported this herself. We'll get onto the significance of that as we continue in this section of the video. So we're now going to go to the 17th of November 2022 in the trial. On this occasion, Dr. Harkness is being asked about the bleeding seen in child E. He says that he had never seen it in a baby to this extent. Now, I want to emphasise a couple of things here. Firstly, the testimony of Dr. Harkness is important because he was the first on the scene when child E collapsed. And secondly, we've seen a lot of statements in this court case where someone has stated that they've never seen this before. Now, that seems to be due to a lack of experience and a lack of understanding to a certain extent. However, it's very clear that this baby was bleeding quite profusely. I think that's undeniable. And that rather more points to a gastrointestinal bleed than the conclusion of Dr. Evans, which we'll come to shortly. So at 1:30 p.m, there was a statement. This was made on the unit at the time. Half an hour to an hour later, there was a large amount of fluid which came up the tube. From memory, it was 12 to 14 millilitres of blood, which for a baby was a substantial amount. Actually, there is far more than that, as we will see. But everything is pointing to this being a very significant bleed that is the critical reason for the passing of this infant. And as Mr. Myers continues to interview Dr. Harkness, he puts it to him that he's dealing with a very serious situation indeed. For some reason, Dr. Harkness only says that this is potentially the case when I would say it's just emphatically true. Dr. Harkness says things were changing, but child E was still stable. Are you suggesting that a baby who has lost a quarter of its blood is not an emergency situation? What I'm suggesting is there are things to do and there is time to do it. Mr. Myers says transfusion was not being considered at this point and one of the obvious things to consider. It is something you had failed to consider, isn't it? Dr. Harkness said it was likely considered, but accepts it was not documented at the 11 p.m. note. So this is supposition here. He's obviously trying to weasel his way out of it and trying to weasel his way out of the fact there were medical mistakes on the unit. There's no evidence that they considered a timely intervention with regards to a blood transfusion, and he acknowledges here that it's not documented. So just to put this into perspective, I've asked this question of ChatGPT regarding how serious it would be for a neonate to lose a significant amount of blood and whether under these circumstances a blood transfusion should be considered. I've also provided the entire background to the infant that was in the panel report, just so this technology can better understand the context. I'm sure if you gave this to any doctor, they would say exactly the same thing, but I don't have a doctor at my disposal to give reactions, so I felt this was the best way that I could do it. Obviously, I do have quotes in my book, but I thought this was a good illustrative exercise. So ChatGPT says, this describes a critically ill premature infant with complex medical issues and unfortunately a fatal outcome. To address your specific question regarding blood loss of 12 to 40 millilitres, here is a detailed analysis. For neonates, blood volume is roughly estimated based on weight. In this case, estimated blood volume 120 to 130 millilitres. Significant of 12 to 40 millilitres blood loss. This would represent a 9 to 11% blood volume loss. This alone is significant in such a vulnerable infant, but not necessarily fatal if isolated and treated promptly. However, the clinical scenario indicates far more severe blood loss than just 12 to 14 millilitres. 2 episodes of massive gastrointestinal bleeding with at least 25% of total blood volume aspirated from the nasogastric tube. This would imply 30 to 35 millilitres blood loss. That is a massive hemorrhage in a neonate and can easily precipitate shock and death if not urgently corrected. Should a blood transfusion have been considered? Yes, absolutely. In massive gastrointestinal bleeding in neonates, especially preterm, critically ill or infected infants, blood transfusion is strongly indicated. While normal saline may temporarily support circulation, it does not restore oxygen carrying capacity, which is vital in hemorrhagic shock. Delayed transfusion can result in progressive hypoxia, poor perfusion, bradycardia, coagulopathy, and multi-organ failure. In this case, after a massive GI hemorrhage, 25% blood volume, waiting 40 plus minutes after giving only normal saline with further deterioration suggests a missed window for transfusion. If no packed red blood cell transfusion was given, this likely contributed to the fatal outcome. Other critical considerations. So here, I won't read all of this, but it's talking about the many other problems and signs in this infant that there were issues that I'm going to go on and talk about later in this discussion. These strongly suggest the baby was developing or had developed NEC with bowel necrosis and hemorrhage, which carries high mortality, especially in extremely premature infants, which we will discuss shortly. Conclusion: 12 to 14 milliliters of blood loss in isolation is significant in a neonate of 1.3 kilograms, but not usually fatal if managed appropriately. However, in this clinical case, the actual blood loss was much higher, and yes, a blood transfusion should have been promptly administered. The fatal outcome likely reflects multifactorial issues: massive hemorrhage, delayed transfusion, prematurity, infection, possible necrotizing enterocolitis, and poor perfusion. So, as you can see here in the panel conclusions, emergency blood transfusion should have been given much earlier. Very difficult to disagree with that verdict. Seems, frankly, blindingly obvious. So, move on now to the discussion of NEC, which is an abbreviation necrotizing enterocolitis. And this was listed in the original pathology report for Child E. We see here Dr. Stephen Breary telling Nigel Wenham of Cheshire Police that Child E was displaying typical signs of necrotizing enterocolitis, and that as an isolated case, he would not have been considered suspicious. So this is in a direct meeting with Cheshire Police in May 2017. It's just relying here on the "it's always Lucy" theory, of course. So at the very culmination of discourse on Child E, the court heard that the infant had been at risk from necrotizing enterocolitis, and this is a condition that is known to cause gastrointestinal bleeding. We'll go over the full background of that in a second, but this is a paper, Association of Gastric Residual Volumes with Necrotizing Enterocolitis in Extremely Preterm Infants, a Case Control Study, from a pediatric journal. And you can see here that this document, this study says that necrotized enterocolitis is a potentially serious illness with significant mortality and morbidity in preterm infants. Previous studies have reported association of volume and colour, bile and blood stained of gastric residuals with necrotizing enterocolitis, and there was evidence of that in this case. So this was this is a news report actually from ITV from the time of the trial, 16th of November 2022. Now, bear in mind that the condition we've just mentioned, necrotizing enterocolitis, has already been entered as the cause of death on the death certificate. The court heard that it was suspected throughout the lifespan of Child E, as voiced by the on-call consultant, and that the infant was treated for the condition via antibiotics, IV fluids, and caffeine. This article discusses the post-mortem related to Child E. And jurors heard that this gastrointestinal disorder was entered as the cause of death on the death certificate. A doctor told the court that at the time I felt the child had necrotizing enterocolitis, which had led to his collapse and deterioration, so I discussed that with the coroner and we agreed for that to be put as the cause of death. This doctor acknowledged that the infant was a high-risk baby and also took into account a colleague's observations of gastrointestinal bleeding and abdominal discoloration. So, to say the least, there is evidence of gastrointestinal bleeding in this infant. So, as mentioned, necrotizing enterocolitis is a serious gastrointestinal disease that primarily affects premature infants. It involves inflammation and damage to the lining of the intestine, potentially leading to tissue death and even perforation. That's very important because there's strong evidence of perforation in this case. This can cause a dangerous infection in the abdomen. During necrotizing enterocolitis, you'll see inflammation and damage, perforation, and potential leakage. and this particularly affects premature infants, babies born before 37 weeks of gestation, which child E was, of course, especially those with very low birth weight, which also applies to child E. So I want to mention that we've already discussed the prosecution case and how the times are incorrect. So this was discussed in the prosecution closing speech that I'm going over in this video, and the prosecution notes the presence of Dr. Hartness at 11 p.m. So, as I've already mentioned, that indicates that the times claimed by the prosecution are wrong. That's the first thing. And then secondly, it indicates that Dr. Hartness is the first person on the scene. That's very important because this is uncontested, by the way. It's not contested by anyone. The prosecution just had to come up with some sort of explanation for this that attempted to make Lucy Letby look guilty. So they made this claim about the times and about her concocting some sort of strange way to cover her tracks. But we now know that that's wrong. But what is uncontested is that Dr. Hartness was called by Lucy Letby herself. Supposedly, now we know that basically this would have happened immediately after she delivered the supposed inflicted harm that was claimed in court. Letby was not the designated nurse for child E, and she called Dr. Hartness even though this could have potentially been incriminating if she had engaged in inflicted harm. So this is not really the actions of someone who had deliberately caused the supposed gastrointestinal tract damage that Dr. Evans concluded. Dr. Hartness also told the court that Lucy was accompanied by another nurse when the deterioration occurred. So it's yet another incident where it doesn't appear to be even logistically possible for Lucy to have done anything malignant. And then another thing to mention is that Lucy cried in court. Due to the traumatic death of this infant, it was child E that she was crying over in court because it was such a horrible situation with blood coming out, and she'd formed a good relationship with the parents, and this infant was really struggling. Then it collapsed, and there was a lot of trauma associated with this. So she broke down and cried. And again, firstly, as I've discussed in previous videos, this is inconsistent with the idea that she never cried, never got upset, was blank, was cold, all of these things. And then secondly, it obviously is not consistent with the demeanour of a guilty person. And then we're going to move on here to look at events from the 29th of November 2022 with this headline, Baby's Catastrophic Bleed Not Spontaneous Trial Told. And this involves the blood expert and haematologist Professor Sally Kinsey, who noted that the child lost an enormous amount of blood. The court indeed heard that child E lost 25% of his blood volume before his death on the 4th of August 2015. So Sally Kinsey, of course, is a capable person and would not contest this. And actually, some of the evidence she gave in court was good. Jurors were told that the bleed could have been the result of an inappropriate use of a medical tool. But really, the more that we look at this, the less feasible and plausible that becomes. So when Ben Myers was speaking with Sally Kinsey in court, he asserted that the comments of Sally Kinsey established that the bleed was not a result of a blood abnormality. That's the only thing that they established, and did not rule out the possibility that the infant could have had a gastrointestinal hemorrhage. He added that Kinsey's observations did not assist with what the cause of death actually was, and Sally Kinsey agreed that all of those suggestions were correct. So it's very important to note this, because all the way through we get Dr. Evans saying, there were lots of other experts in court. But this is an instance, Sally Kinsey appeared in court, but her observations did not in any way assist with the cause of death. And she stated that very clearly herself. So all she really did was say there was a lot of blood, which everyone agrees with. The question is, how did that blood occur? And the likelihood that it came due to an object being thrust down the throat of this infant by Lucy Letby, and it suddenly that created this enormous amount of blood loss in a very short period of time, when she's got other people around her, when she's not even the designated nurse for the infant, when she raised the alarm herself to the gentleman, Dr. Hartness, who immediately, I think Dr. Hartness was a female, I should say, who immediately, no, it's Dr. David Hartness, no, that is correct. who appeared on the scene immediately. Obviously, Lucy Letby has raised the alarm. So this is an instance where there is a supporting expert witness, but the supporting expert witness does not support the prosecution case, gives no support to the testimony of Dr. Evans. In fact, the observations of Dr. Sally Kinsey are far more supportive of the idea that there was a gastrointestinal hemorrhage. Now, I apologise if you can't see the screen, but on the screen now is a nasogastric tube. Now, I think you can see quite clearly that it would be phenomenally difficult to create a significant injury in a short period of time with this device so that the infant lost 25% of its blood in a very short period of time. And this is what Dr. Evans initially alleged. Central to this case is this substantial amount of bleeding, which Dr. Evans described as significant hemorrhaging from the upper gastrointestinal tract, alleging that it had been caused by a relatively rigid object. In initial reports, Dr. Evans had been at a loss to explain this hemorrhaging before deciding that a nasogastric tube could have been thrust into the infant's stomach. He then later changed this view, not for the first time, having realised that this would be logistically impossible, instead suggesting that there were a number of bits of equipment on the neonatal unit that are relatively rigid. As with the entire trial, this was yet another case completely founded in the hypothetical. It is also interesting to note that Child E was receiving insulin, but Lucy Letby was not alleged to have poisoned him, as with his twin, Child F. Instead, she supposedly introduced yet another method of inflicted harm. So, logically speaking, if she thought that she could poison the other twin with insulin, as it is alleged, there would be no reason for not to attempt to poison Child E with insulin. But instead, she attempted this very haphazard method where she could easily have been detected by people on the unit, where it seems highly unlikely that it would be possible, even possible, to create the sort of injury required to lead to that degree of blood loss. And she's supposed to do this when there's other people around her. And then Dr. Evans changed it anyway because he realised that there wasn't a nasogastric tube available. As mentioned here, Dr. Evans had been at a loss to explain the hemorrhaging in initial reports. And this led to Ben Myers stating to him, "You were looking for something that could possibly support an allegation of deliberate harm that you must have known was not realistic." And of course, that seems to be an entirely fair remark. So during the court proceedings, Professor Sally Kinsey, as we know, indicated that Child E could have suffered a gastrointestinal hemorrhage. Both Dr. Evans and Dr. Sandy Bohin stated otherwise. Dr. Sandy Bohin asserted that the bleeding may have made Child E unstable, but I don't think that is what caused his death, which is a frankly staggering statement for a neonate that lost 25% of its blood. His blood, I should say. Dr. Evans was similarly adamant that there couldn't possibly have been an innocent explanation for the bleeding and that it must have been caused by inflicted trauma. But actually, when you examine the scientific background to this, you find out that there is a lot of evidence that gastrointestinal bleeding can occur in infants and then it can occur naturally. So here is the first paper that we're going to look at, which is Stress-Induced Gastric Findings in Critically Ill Newborn Infants, Frequency and Risk Factors, published in Intensive Care Medicine Journal. So the main results here of this paper were that of infants treated in the neonatal intensive care unit, 20% had signs of gastrointestinal bleeding. So 1 in 5 actually had signs of gastrointestinal bleeding in this study. This is another paper from another pediatric journal, Hemostatic Challenges in Neonates. And this actually deals with sepsis. So this was another infant, yet another infant on this unit that was septic. It's known that sepsis is a major risk factor in gastrointestinal bleeding, particularly in critically ill and vulnerable patients, because the gut barrier can become compromised in sepsis, allowing bacteria and endotoxins to enter the bloodstream, worsening inflammation and mucosal injury. Note that mucosal injury refers to the inner lining of the organs. Sepsis has been linked with the perforation of the bowel in numerous studies, including this one, which examined neonates. Now that's really important because we've already seen references to perforation, and we're going to see further references to perforation as we continue. So in this clinical overview of bleeding in the neonate, we see in the highlighted section that a recent study utilising a standardised and validated neonatal bleeding assessment tool found that 25% of all neonates admitted to 8 different NICUs experienced an episode of bleeding during their hospitalisation. So that's even bigger than the 20% that we just saw in the previous study. Among these episodes, 11% were categorised as major severe bleeds. So if you know, it's 11% plus 1% plus 13%. So that refers to the 25% here. So the 11% of major and severe bleeds is nearly half of all the incidents. So you're looking at 1 in 8 children that were admitted to this neonatal unit as a neonate experienced a major or severe gastrointestinal bleed. But both Dr. Evans and Dr. Bohin have said that there's no possible way that this could have happened naturally, even though this study indicates that this will happen over and over again. So there are numerous infants in a neonatal unit each year. Several of them will experience gastrointestinal bleeding, severe gastrointestinal bleeding, based on this study. So I'm going to move on to this now, perforation of the gastrointestinal tract and peritonitis in the neonate. And this study noted that perforation was most frequently associated with necrotizing enterocolitis, spontaneous gastric perforation, and intestinal obstruction. So there is very strong evidence suggesting a bowel obstruction in Child E, as the infant's only stooled once during his life, and as mentioned here, this is another risk factor associated with gastric perforation. This is another study on the obstruction of the bowel, gastrointestinal perforation in neonates, etiology and risk factors. And you can see here that the cause of perforation in the infants was necrotizing enterocolitis and intestinal obstruction, which are 2 conditions linked very strongly with this infant Child E that could have caused the massive, what seems to be very clear gastrointestinal bleeding that has been observed and that actually isn't contested by anyone in this case, even Dr. Evans. So in the same study, we see this assertion that gastrointestinal perforation in neonates presents important challenges and mortality can be high. Indeed, later in the study, it is reported that neonatal intestinal perforation is high, ranging from 40 to 70%. So that's 40 to 70% of neonates that experience intestinal perforation can expect to die. So it's a very, very serious condition. And this is another paper from the time, Intestinal Perforation in Very Preterm Neonates, Risk Factors and Outcomes. This was available at the time. It's in a perinatal journal, and it's just another one pointing to intestinal perforation here. This is really important here because this particular paper indicates that of the 2 types of intestinal perforation, perforation related to necrotizing enterocolitis was associated with the highest risk of an adverse neonatal outcome. So we know already that perforation is potentially deadly in a high number of cases, and if there's necrotizing enterocolitis, then the chances of survival are even slimmer. And this is another study, intestinal perforation in very low birth weight infants with necrotizing enterocolitis, that points to exactly the same thing. And all this evidence led one neonatal expert to tell me that everything we're seeing in Child E is a classic sign of intestinal bleeding and a strong indication of either necrotizing enterocolitis or major bowel tearing or perforation. The vomiting of fresh blood indicates that there was likely some intestinal or stomach tearing. So this is yet another paper, another pediatric paper, a recent one, total gastrectomy with delayed Hunt-Lawrence pouch reconstruction for neonatal gastric perforation presenting with hematemesis. That probably is. So that is an awfully complicated sounding title. But the important thing to note is that presenting symptoms for gastric perforation include abdominal distension and emesis, which may be bilious, non-bilious, or bloody in nature. So everything is pointing to these conditions that the neonatal expert has just pointed out and that the panel have cited in their report. It was also pointed out to me that CPAP was a major risk factor. This is a form of respiratory support for Child E, and that CPAP can contribute to this bilious, non-bilious, or bloody discharge, emesis, that is mentioned here. So overall, there is considerable evidence here for catastrophic bleeding in this premature infant caused by a constellation of vulnerabilities and natural occurring factors. During the court case, Ben Myers cross-examined Dr. Evans on this very matter. And he said to him, the hemorrhaging that Child E experienced on August the 3rd and 4th could be due to some form of ulceration or bleeding from the stomach from natural causes, albeit not normal. Dr. Evans said, I don't think so. Then he made this comment about you were looking for something that could possibly support an allegation of deliberate harm, and he said that he disagrees. And then he said, you are actively trying to find things that would support this allegation, even when there is no evidential basis. And Dr. Evans says Child E had a massive hemorrhaging from his upper gastrointestinal system, and that is not something that occurs as a result of some kind of natural phenomenon. So firstly, that statement is incorrect, because we've seen you do have naturally occurring hemorrhaging quite regularly, and that nearly half of the naturally occurring hemorrhaging that occurs in neonates, which is not trivially present in approximately 1 in 8 neonates, according to this study, half of those bleeds are major or serious. So to say that it does not occur as a result of some kind of natural phenomenon is incorrect. Additionally, even if it was correct, which it isn't, that does not mean that the only explanation is Lucy Letby using some blunt instrument to somehow create this injury that resulted in the baby losing 25%. That is just unfeasible. It's unfeasible if she's in the unit on her own. But with all the other people around and everything else that's going on, the fact she was accompanied by another nurse, and the fact that she raised the alarm, it just becomes stupendously ridiculous. So this was another statement that was provided for me from a neonatal expert. Dr. Evans stated that there is no natural phenomenon that can cause this kind of bleeding in a neonate, but there are causes that match the clinical picture of Child E. There are natural explanations more common for his clinical picture, and Child E had risk factors that matched for these natural explanations. So that's pretty much self-explanatory, and I think we can see very clearly that everything is pointing to gastrointestinal bleeding due to natural factors and due to pretty severe mistakes and clinical errors that were made on the unit. Speaking of mistakes on the unit, there should have been a post-mortem for Child E. And we saw this exchange in court where the doctor stated that was being cross-examined, a post-mortem would take place if we didn't feel we had a cause of death. It can be requested for any baby who dies if the parents want that investigation. The parents were understandably devastated that Child E had died and were not keen on a post-mortem, and I didn't want to make a terrible situation any worse, so I didn't push, which is something I now regret. Now, I'm not being unduly critical of this doctor, but it's clear that the parents did want a post-mortem and that they were discouraged from doing this because they were told that it wouldn't tell them anything, as we'll see shortly. Ben Myers KC defending said, this is precisely the type of situation where a post-mortem would have been very helpful, isn't it? And the doctor said, I regret for not pushing for a post-mortem at that time. But at the time you were questioning necrotizing enterocolitis, and at the time you didn't have an obvious explanation. The doctor replied, I completely agree with hindsight. I should have requested a post-mortem. I was keen to avoid that, to avoid any distress. She turned to Child E's parents and said, I apologise to them that I didn't push for that. Mr. Myers suggested you, in effect, steered them away from a post-mortem. The witness said, I don't believe that was the case. But on Monday, Child E's mother told the jurors that the doctor told them a post-mortem would not tell us very much. She said her and her husband decided not to ask for one, largely because it was explained to them that was little point. But in fact, had there been a post-mortem on this infant, this would have been yet another one in which the pathologist would have disagreed with the conclusions of Dr. Evans, and he would have had to override the pathology reports in order to put his crap in the court case. And indeed, Dr. Jane Horden, the pathologist, stated at the Thirlwell inquiry on the 12th of November 2024 that the gastric bleed of Child E was significant and was the likely cause of the collapse, completely contradicting what Dr. Evans said in court. Gastric bleeds are sadly not unheard of in vulnerable and poorly babies, again completely contradicting what Dr. Evans said in court. Isolated gastric bleeds in stressed babies, unfortunately, are not uncommon, again completely contradicting what Dr. Evans said in court. Nevertheless, he felt comfortable in completely overturning Dr. Jane Horden, who is a pathologist, who is currently working, and who identified the infant, none of which applies to Dr. Evans, of course. So there is a lot of medical information there, so I'm going to go through this and summarise it before we return to finishing off this section of the prosecution closing statement. Firstly, it is known and not contested that Child E was a vulnerable infant with multiple chronic issues. There is overwhelming evidence pointing to this infant suffering with a massive gastrointestinal bleed. This is supported by both clinical signs and considerable scientific evidence, while even the evidence of Professor Sally Kinsey in court was supportive of this. There were numerous signs consistent with necrotizing enterocolitis, which was cited in the original pathology report for Child E. Sepsis could also have exacerbated observable clinical signs, and this was one of the many infants on the unit suffering with suspected sepsis. Another risk factor for gastrointestinal bleeding is bowel obstruction, and it is undeniable that this was a major issue for Child E. Lucy Letby both alerted Dr. Hartness to the collapse of Child E and cried in court due to distress when the traumatic events were discussed. There is also clear evidence that mistakes were made on the unit with regard to blood transfusion. The parents of Child E should also have been offered a post-mortem, but were not. The major medical mistakes made with Child E are yet another indicator that the doctors on the unit were not up to the task, both operatively and diagnostically. This therefore calls into question much of the evidence that they are presented in court. Even despite this, doctors on the unit, the pathologist Dr. Jane Horden, nurses, and experts who examined the case since, all recognised that the degree of bleeding was significant and that this was a very vulnerable infant. Dr. Stephen Breary even conceded, when speaking with police, that, in isolation, the sad demise of this infant would have raised no suspicion. The theory of Dr. Evans that Lucy Letby used a nasogastric tube to harm this baby is preposterous and unfounded. Dr. Evans seemed to acknowledge this himself as he later changed the subject supposedly used away from a nasogastric tube. Everything in this case points to gastrointestinal perforation, leading to a massive bleed that was never addressed adequately on the unit. The prosecution case also hangs on the parents' testimony regarding terms being correct, but it's quite simple to demonstrate that this is incorrect, which fatally damages the entire prosecution case for Child E. With this in mind, we know that the claims regarding the prosecution, the falsification of datics and system notes, are plainly wrong. Lucy Letby correctly recognised the problems with Child E and noted them on the system at the time. Her view has since been corroborated by world-class neonatologists. Finally, now that the prosecution case is in tatters, it should be noted that this is supposed to be one of the strongest cases. It was showcased early in the prosecution's closing speech and formed part of the first panel summary. In fact, the prosecution for this infant is utterly specious, weak, based on supposition and fabrication, and utterly discredited. So we'll return to the statement of Nick Johnson and we'll try to pedal through this as quickly as we can now. So we see him say here, the answer is it was a panic reaction told to a mother who knew no better, and it was designed to cover her tracks. When you're considering whether or not the mother of baby E and F is accurate about that, ladies and gentlemen, bear this in mind. When Lucy Letby was struggling in interview to explain why it was that baby N was bleeding, and we will come to this, there's a 1 mil bleed that she wrote on a chart that she never escalated to anybody, so she was being asked about that in interview for baby N, and she came up with the same line under pressure from the police. So there's a few things that we need to go over there as quickly as we can. Firstly, we now know that the whole prosecution case about Lucy Letby has fabricated something to cover her tracks, we now know that is a fabrication, and we know the prosecution's case doesn't stand up, so that can be completely dismissed. Obviously, this is used to try and suggest that Lucy Letby is a liar, so as we know that is untrue, that also has no credibility. We're going to come back to this baby N issue because it will be discussed later in this passage in future videos. But what I will say is, remember, Lucy was the person who noted in the datex for Child E that it was suffering with a gastrointestinal bleed. We now know that is correct. We also know, as I mentioned in previous videos, that when I speak to neonatal nurses, and I've had a neonatal nurse look at all of the datex for that's available from the Thirlwell inquiry, she told me Lucy Letby is the most conscientious person on the unit. That is absolutely in accordance with information that we know from the thermal inquiry. So I will return to this argument in more depth, but I would suggest that it has no basis whatsoever. So we're going to go into the baby N interview, please. It's in jury bundle number 2, interviews bundle number 2, about halfway through. This is really important to the case of baby E. It may seem like an absurd thing to say. It is. It is. Baby N and baby E are completely unconnected. So what we're about to hear from Mr. Johnson now is an absolute concoction and fabrication. It's like drawing all these absolutely tenuous things together, all these strands, and then trying to make a narrative. And of course, a narrative ultimately, I mean, I speak as someone who is a published novelist, it's just making stuff up in your brain. You just sit there, literally, there are certain techniques you can use to write fiction, but ultimately, you just have to sit there and come up with something. And that is what they have done. And this is absolutely a narrative. And it's all, oh look, we say Lucy Letby could have done this. Oh, and look at the similarities between baby N and baby E, even though they happened at completely different times. And then we say that this happened. And then why is Lucy Letby such a liar? And then it's bullshit. It's complete bullshit. You can see the complete lack of any real facts in this entire statement. But we'll continue. So being asked about this 1 mil bleed, so a small bleed for baby N, you can see a response by Lucy Letby. If the NG tube's been inserted forcefully, it can cause a bit of trauma going down. I wouldn't say it's common, but it can happen. She was then asked, but in your experience, that has caused in the past bleeding, has it? And she replied, yeah, it can do, yeah. She was then asked, is that bad bleeding or just a small amount of blood? And she replied, no, just a small amount. She was then asked, right, okay, so just 1 mil. So again, I've already dealt with this. I'll just mention once again, this is the prosecution requiring Lucy Letby to explain everything that happens on the unit. And she replied, yeah, I wouldn't expect any more than that. Now, this is really important, ladies and gentlemen. It's important because remember what the mother of baby E&F was actually describing. She was describing a small amount of blood around the mouth, wasn't she? Do you remember that? This is all irrelevant now because of what we've discussed. That's why I'm going to go through this quickly. Do you remember that if the mother of baby E&F, as Lucy Letby would have it, was really down there at 10 o'clock, baby E was producing lots of blood by 10 o'clock. So under pressure from the police to produce an explanation for blood with another child, blood in a child with haemophilia, blood that hadn't been escalated to the medical staff, she came up with that as an explanation under pressure on the night of August the 3rd, 2015. The pressure of a mother arriving with milk and a child with a small amount of blood around its mouth, like baby E had, she came up with the same explanation. That is why, so this is just they've just pulled one line out of the police interview in an attempt to justify why Lucy Letby falsified the nursing notes for baby E, although that's not actually true, because the prosecution case doesn't stand up to scrutiny. They don't have any evidence for Lucy Letby falsifying the nursing notes for baby E. The entire basis for that is saying that, oh, look, the times were wrong. But actually, when you assess the times, it's far more likely, overwhelmingly more likely, that Lucy Letby's times were correct, which you would expect because she was a nurse that was noting the times down on the system, and we know she was very diligent at doing that. We should expect her account to be more accurate than the parents who were traumatised, who don't spend their time in a hospital, who've never dealt with this kind of situation before. And indeed, the prosecution's case just does not stand up. But please understand, that is the entire basis for them stating that the notes were falsified for child E. Were just these ridiculous snippets that they pull out, and this assertion about the timing that we know is wrong. And no doubt they will use this as precedent, just as they used the pyjamas and the shredder to say that Lucy Letby is a liar. They try to find just some strand somewhere that they can just pull out of something and then say, oh, look, there you go, we've proven she's a liar. Oh, look, there you go, we've proven that she falsified the notes. Even though they've provided no material evidence whatsoever that she falsified the notes. So I want to be really clear on this point, because lots of people believe that she falsified the notes, but there's actually no material proof of that whatsoever. In fact, the evidence typically points to the opposite, and obviously we'll be going through that more and more as we go through this closing statement. But in this particular case, with regard to Child E, we know there is literally no evidence that Lucy Letby falsified the notes, and all the information that we do have would indicate that she didn't falsify the notes, which is perfectly logical, as there's no reason to believe that she would, because every person that she works with says she's an excellent nurse. Every person that she works with said that she's diligent. The leader of the nursing department specifically said she's the most conscientious completer of datex on the unit. I've had a neonatal nurse look at the datex. She said exactly the same thing. It's only the prosecution that is obviously chronically biased by its very nature that can make this unfounded claim about falsifying the notes, but it's just simply not true. That's the evidence. We suggest that you can be sure. You can be absolutely sure that the mother of baby E and F is telling the truth, because what we saw and heard caused us such concern that she rang her husband. The phone records prove that she made a call, don't they? They don't prove what's in the call, of course they don't, but they prove that she made the call. If I just remind you of tile 122, please. This is a call at 9:11, so 21:11, 4 minutes and 25 seconds. The mother of baby E and F told you what she said to her husband. The father of baby E and F told you what she said to him. Have the parents of baby E and F made up to get Lucy Letby? Because that's the choice. So again, this is another false equivalence. All the time, we're going to see this all of the way through the entire speech. We're being given this false equivalence of you either have to believe what we're saying or you have to believe what Lucy Letby's saying, so we're setting Lucy Letby up to be a liar in these ridiculous ways. Are they in on it? So this is a straw man argument. Are they a subgang of two? Or are they telling the truth? So this is all straw man arguments, obviously. Is Lucy Letby telling the truth when she says that the mother of baby E and F came down at 2200 hours? Yes. Yes, she is. Well, the mother of baby E and F told you that after the 2100 hours event, the next time she went down was when the doctors were working on baby E, trying to save his life. Is she wrong about that? Yes. She's wrong about the times. She's not wrong about the events, she's wrong about the times. Of all the things in your life that you remember, ladies and gentlemen, I hope none of you have ever been in that position, but you just remember, might you, seeing your son in a terminal decline. Now, of course, that's another false equivalence, because no one is saying that she doesn't remember being in that position. Of course she remembers being in that position. The fact is that the specifics could be very, very shady for numerous reasons. In fact, the fact that she's so traumatized about it can easily create false memories and incorrect recollections, which is indeed what has occurred. And of course, the prosecution is trying to set this up as a simple, the mother, why would the mother lie? The mother couldn't possibly lie. Lucy Letby's a liar, we know that because of the pyjama incident. And that's a ridiculous false dichotomy that is being created in order to say, look, you have to come down on this side or you have to come down on that side, because that's what the prosecution does. The prosecution tries to present the jury with a bold choice, a very simple choice. And so this entire closing statement, one way of describing it is as a narrative. The other is that it's essentially a fabrication of numerous events to create a scenario in which they can say, look, you either have to choose between this and you have to choose between that. We'll leave that up to you, but by the way, if you choose that, you have to believe Lucy Letby is a liar. And that's what the whole closing statement is. But let's continue. And we suggest there can be only one sensible reason why she would falsify the nursing notes, which we haven't provided any evidence for. It's not a case of mistake creeping in, is it? Or to use her phrase, an error. This is a fundamental difference between the mother of baby E and F's compelling account and the lying written record made by Lucy Letby. So I shouldn't need to comment on that too much, but you can see what the prosecution is trying to do here. I don't think I can accuse the prosecution of lying, but they've clearly fabricated things and they've clearly used misrepresentation. So if anyone is lying, it's them, really. But I wouldn't strictly describe it as lying. What I would describe it as is an extremely tenuous series of assertions that are very poorly founded and rely on several fabrications and numerous examples of misrepresentation. Do you remember being told that a message had come up from the labour ward and the mother of baby E and F was so upset by what she heard that she asked the midwife to use her phone to phone the father of baby E and F? You can see it's a long call, 14 minutes and 30 seconds. Just park that time in your head if you would, 22:52, and go to tile 128. Click on that please and scroll down. Just before 2300 hours, here is Dr. Harkness's note. He times it at 2300 hours, obviously he's not using a stopwatch. So here you can see this corroborates the account of Lucy Letby, because there is no logical or even plausible reason that Dr. Hartness is going to appear at 2300 hours, 2 hours after this is supposed to have happened. The whole incident that they're talking about, that they're hanging, the assertion that Lucy Letby falsified the notes entirely hangs on this 9 o'clock or 10 o'clock discrepancy. And we can see here quite clearly it's far more plausible that it's 10 o'clock. It doesn't make any sense at all for it to be 9 o'clock, even according to assertions made by the prosecution. So let's continue. This is the beginning of the final dramatic collapse of baby E, and it coincides, doesn't it, with a telephone call made by the midwife to the father of baby E and F. It does, but that part of the timeline is correct. The problem is your assertion that Lucy Letby is lying is based on a timeline that makes no sense. If we look at tile 153, please, the family communication note is what I'm interested in. If you read down about 5 lines, it says, both parents present during resus, fully updated. There is in there a reference to having contacted the midwife, called the midwife. So the bits of the jigsaw all fit. As with all jigsaws, they only fit one way. So it is reasonable to describe this as a jigsaw. But the problem is, they started with a picture that they made up themselves, and then they cut the jigsaw pieces out, and then said, oh look, we've cut all the pieces out, and it fits together into a jigsaw. So that is not a good analogy. It's the jigsaw is not something you fitted together, having been presented with the pieces. You've made up the pieces, and you've made up the final picture, and then you've said, oh look, the pieces we've made up fit the final picture. So that analogy doesn't work. And the image on the jigsaw corresponds to the account given to you by the mother of baby E and F. And it completely undermines, we suggest, Lucy Letby's version of these events, as we know it doesn't. So we suggest that Lucy Letby was interrupted by the mother of baby E and F at 9 p.m, and she then worked on creating the impression that baby E was ill, which is completely and utterly implausible. You know, demonstrated very clearly in this video that that version of events is absolute bullshit. And now they need to invent even new things to even make this work. And she used her friend Belinda Williamson to make one of the notes in the chart to give the impression this was all something that Belinda was involved in as well. Or far more likely is that Lucy just simply, she may not even have asked her, she may not even have interacted with Belinda Williamson. Belinda Williamson may simply have made a note completely independently, which is indeed what you would expect to happen in these circumstances. Or maybe they did collaborate on it. But to say that she used her friend to make one of the notes to give the impression that she was... It's becoming even more labyrinthine by the second. I mean, this is just an absolute fabrication. It's just absolute nonsense. So anyway, the prosecution agreed that Lucy called Dr. Hartness. Of course she did. And for a short time, baby E recovered. Then once Dr. Hartness had left, she attacked him again. And as baby E entered his final collapse, somebody rang the postnatal ward to call the mother of baby E and F. And so upset was the mother of baby E and F by what she heard that she called her husband. So none of that has actually occurred. So, I mean, that's just all made up, essentially. If you agree and you're sure that that's right, then it's clear evidence of falsification, isn't it, in those notes? No, it's not. It's not clear evidence. It's very poorly founded fabrication. As I say, it's effectively making the picture up yourself and then cutting all the jigsaw pieces out. It's just complete rubbish. And would Lucy Letby, have done that if baby E died from natural causes? What does that even mean? What does that even mean? It doesn't even mean anything. That doesn't even make any sense. It's powerful evidence, isn't it? Independent of the medical evidence, powerful evidence that Lucy Letby murdered baby E. No, it's not. It's not any evidence at all. It has no evidential value. It's all wrong. It's all based on supposition. It's based on misrepresentations. It's not powerful evidence. It's very, very weak evidence. In fact, as I say, it has no evidential value at all. When the mother of baby E and F caught... I mean, this guy goes on and on and on, by the way. When the mother of baby E and F caught Lucy Letby red-handed, which never happened, so that is an actual lie. That is an outright lie, because we know for a fact no one caught Lucy Letby red-handed in this court case. This just did not happen. We know for a fact. It is an established... No one denies this. No one contests this in any way. It is known that no one has seen Lucy Letby do anything wrong. If the mother of baby E and F had caught Lucy Letby red-handed, you would never have heard from me. I would not be defending her. I would not be doing this channel. I would not have written my book. You never would have heard my name. Even if there was one incident in which she'd been caught doing something malignant or something that is explicitly suspicious even, then I wouldn't be supporting her. The only reason I'm supporting her is because, or one of the primary reasons, is because that never happened. We know that for a fact. So how the prosecution can say in court that baby E and F caught Lucy Letby red-handed when that is categorically untrue, I do not know. She didn't realise what was going on, of course. No, why would she? Because she wasn't doing anything wrong. She wasn't engaged in any malignant acts, so there was no basis for her to realise anything. But her natural instincts told her that something was up. I mean, this is just supposition and fabrication again. Dr. Harkness was the person who had to deal with the consequences of Lucy Letby's sabotage, and he gave evidence on November the 17th. And he gave us, in effect, a chronological framework, didn't he, for what has happened. He told us about the handover and the time that takes, that he and Dr. Wood were covering the shift and that they would have spoken to the nurses. And though his note is timed at 10:10, he accepted on the cross-examination that he was probably on the neonatal unit from about 9:30. So he didn't know. He didn't know what time he was on the neonatal unit. That's why the prosecution is saying here he was probably on the neonatal unit from about 9:30. He doesn't know that. I will, at some point, probably go over that cross-examination. I might begin that the next time that I continue with this closing speech summary analysis, because this section is not going to be finished today. We're not going to finish Child E in one go because it goes on so much. So I might begin next time by looking at the cross-examination of Dr. Harkness and seeing exactly what he said, which I'm aware of already. If you think those times are important, we're not suggesting they are. We're not suggesting they are. We've just devoted like half an hour to discussing them. We're not suggesting they aren't, but if you think they are, you might want to look at tile 125 of the baby E sequence. That's the fluid balance chart. If you look at the 2200 hours column, so it's in the bottom right hand corner there, you will see that Lucy Letby has written 15 millilitres of fresh blood. I say she wrote it because Lucy Letby accepted in evidence that it's her writing, but we suggest that she had manipulated circumstances so that this was an entry that was signed by Belinda Simcock or Belinda Williamson, as she's now known, although we have no evidence for that. We just made that up. What is far more likely, of course, that Belinda Williamson just signed off on it. And the point of that, and this is where the other cases become relevant, isn't it? The point of doing that is to disassociate herself from this event if anyone ever goes back to look at the paperwork. Another possibility is she just wasn't associated with him in the first place. So just as in other cases, even if she wrote data and didn't sign or got someone else to write things in at the time she was doing things, and when on the 24th of May this year she was asked about that apparent anomaly, she said of that entry 15 mils fresh blood, I assume it came after Belinda's documentation. That was the evidence she gave. So she got Belinda to sign entry and then adds to it. So that's not true. We don't know that's happened. This is, again, just a fabrication. You'll remember this in the context, won't you? Do you remember HS, the child, in a different nursery when baby I collapsed for the final time on the 22nd, midnight on the 22nd, 23rd of October? HS, the child who was going to Stoke. After, in that case, Christopher Booth had signed the infusion timed at 2300, she altered the time to 2400. So we'll have to have a look at that in a later video. That I'm sure that the prosecution will come back to that. We could possibly begin by looking at the next in the next video, but we can say almost certainly that will turn out to be completely incorrect. This is where you put all the little bits, all the bits and pieces together, ladies and gentlemen. It's utterly obvious, isn't it, what's going on here? What Lucy Letby did here was sabotage baby E after Belinda Williamson had written her entry. She puts it in under Belinda Williamson's initials, so that it looks like Belinda Williamson is involved as well. So what could possibly be wrong about this? So there's literally no basis to make that assertion. I'll say that once again. There's somebody else there when this happens when you look at the notes. Although Dr. Harkness was persuaded in cross-examination that his note at 2210 was really for events from about 2130, you may think that the note there timed at 2200 makes that concession dubious, to say the least. You could say that. You could say that it makes it dubious, yes. So there's a couple of things to mention here. Firstly, they have to create a timeline that makes Lucy Letby look guilty when that timeline makes absolutely no sense, as they themselves are acknowledging here. And the second thing is, they have to try to explain away the fact that Lucy Letby was not the designated nurse for this infant, and Lucy Letby has called Dr. Harkness to alert him to suffering, a collapse of a child, etc., etc. So in any normal circumstances, that would look like a responsible thing for a nurse to do, and in any normal circumstances, the entries here meet the timeline that I've already mentioned when I discussed it earlier. And in any normal circumstances, Belinda Williamson signing for something is Belinda Williamson signing for something. It's only in these circumstances where they have to pull all these ridiculous strands together to concoct this ridiculous narrative that they can say, oh, look, just because Dr. Harkness has signed something at 10 past 10, which fits in with the idea that he was there at 10 p.m. In fact, it's obvious that makes perfect sense. We can't allow that because we have to claim that Lucy Letby has forced a nasogastric tube. Oh, no, it's not a nasogastric tube. We're changing our mind on that. It's a different type of tool, in fact. It's not a nasogastric tube because Dr. Evans has realised there wasn't a nasogastric tube available. So he's had to say something else instead. So we have to concoct all these things so that Dr. Evans can make this spurious claim about something that didn't happen medically when there's a massive gastrointestinal bleed, and then we have to say, oh, Lucy Letby falsified all these things, although we don't have any evidence for that, and Lucy Letby did this towards Belinda Williamson. She's like fabricated things and falsified things related to Belinda Williamson, although we don't have any evidence for that. We have to create a new timeline, although we don't have any evidence for that. But hey, we're now going to explain to you why this is all perfectly reasonable. So we're in the final furlongs of this now. A reason why Lucy Letby needs Dr. Harkness to be there earlier is that she needs an innocent read for omitting the feed at 2100. She needs to get the doctor in there earlier as a reason for omitting the feed at 2100, which in turn undermines the mother of baby E and F's evidence. So if you're looking for why Lucy Letby is doing this, that is the reason. So, I mean, that seems pretty tenuous to me. We can go over the cross-examination of that, but I really don't want to spend any longer on this aspect of the court case because we know it's a complete fabrication. She was caught sabotaging baby E by the mother, so that's just an outright lie. And this is what she does. This is what she did, we suggest, to cover herself. When he arrived at 22:10, Dr. Harkness was told by Lucy Letby, though 30 minutes earlier there had been a dirty aspirate. If he was there at 22:30, then you can see why Lucy Letby is so keen to put at 2100 hours, which is when the mother of baby E and F are there. You can see how all the bits fit together, can't you? We then have the sudden large blood-stained vomit and a 14ml aspirate, apparently, so not 15, a 14ml aspirate, which had been taken at about 2200 hours. That's what caused Dr. Harkness to suspect there was some sort of gastrointestinal bleed. So Dr. Harkness believes this as well, of course. It's only Dr. Evans, the neonatal experts, people on the unit, Lucy Letby, the pathologist, they all suspect it's a gastrointestinal bleed. It's only Dr. Evans that says, oh, she's forced a nasogastric tube. Oh, no, wait a minute. There's probably some other rigid thing there. It was probably that, even though that makes no sense. Medically, it just stands up to absolutely no scrutiny whatsoever. So he says here, but when he examined baby E, all the signs were good. I mean, this is just due to, I'd say, a spectacular mistake by Dr. Harkness and people on the unit, because it's very clear that this infant was suffering from numerous chronic problems. So to say that all the signs were good is just an absolute joke and frankly farcical. So I'm going to stop there. We're only roughly just over halfway through the prosecution closing statement just for child E. I want to finish by just giving a very short summary of a few themes that are central to this closing statement in this particular section. So finally, I want to go over 7 themes from this closing statement. The first one is there is a clear attempt to create a dichotomy between Lucy Letby and the parents, so the jury is presented with a binary decision between coming down on the side of the parents or Lucy Letby. The second theme is very much related to that, because in order to do this, Lucy Letby is portrayed as a liar, using various manipulative prosecution tricks in order to achieve this. Conversely, the parents are portrayed as emotionally tormented and beyond question, which is difficult for the defence to counter as they can't attack the parents in the same way that Johnson can and does attack Lucy. Thirdly, the prosecution leans on the doctors as being trustworthy, which feeds into the halo effect that doctors seemingly possess. Fourthly, the prosecution case relies heavily on pulling together what seem to be and are completely unrelated strands in order to tell what is a highly tenuous story. This narrative, as applies to any adept example of storytelling, requires the prosecution to simply invent things. In the case of child E, we know that the medical information is tragically incorrect. Everything points to this infant passing away due to massive bleeding due to gastrointestinal perforation, and this was exacerbated by a very poor response from the hospital. What the court heard medically from the prosecution in the case is, to put it generously, fanciful. Remember, this is supposed to be one of the strongest cases, which is why it's front and centre in the closing statement. And I suppose an eighth thing that I should mention as well, just to reiterate, is that this idea that Lucy Letby has falsified notes is very much based on this narrative that is concocted during this part of the closing statement and which indeed featured in the court case as a whole. So that's the end of this part of assessing the closing statement. I'm going to try and do one of these videos every week because I feel we need to get through it. People always say to me, "Oh, have you seen the court transcripts?" So I feel if I go through what is supposed to be the strongest arguments of the prosecution and the most important statement in full, then that would be really useful and valuable. Of course, as you can see, this takes a significant amount of time, but hopefully as it goes on, it'll be possible to do some sections a bit more quickly than we've done this section. So in the next video that I film next week, record next week, we will continue with the second half of what the prosecution said about Child E. So thank you again for your support. I'll probably make another video in a couple of days, but it will be much shorter as I realise it'll take people a while to watch this one.